Hi there, I'm Dr. Aruna, Holistic Psychiatrist and founder of Trinergy Health and Psychiatry 2.0. So in this video, I wanted to talk about the connection between trauma and autoimmune diseases. So here's what happened in my practice. So when I started my holistic psychiatry clinic in 2016, I was coming at patients' problems from the lens of Ayurveda and functional medicine, which is basically that when in doubt, heal the gut. So that's the approach I was taking. But more and more, as I began to recognize that some of my patients were actually diagnosed with autoimmune diseases. Some of them, I would diagnose them with autoimmune diseases like Hashimoto's, lupus. I've had the privilege of exploring these conditions and being able to diagnose and help these patients heal from it. But a curious thing that I began to observe is that these were women that had experienced trauma in their early life. And then I read the book The Body Keeps the Score by Bessel van der Kolk, who also came up with the same observation. And then I read the study, the ACE study, Adverse Childhood Event Study, and it became clear to me. Of course, I went back to Ayurveda, where again they talk about loss of self-worth as the primary root cause for any disease. And what does trauma do? It robs us of our self-worth. And from all of these articles and books that I've read, what I figured is that what happens in trauma is that we are creating a heightened cortisol state in the body of the child. Too much cortisol over a period of time is actually harmful to the gut lining, resulting in leaky gut. When leaky gut sets in, digestion comes down, so the child is not able to digest their food, especially the proteins in the food. The harder proteins that are in dairy, in gluten, in soy, and eggs. These are the proteins that become harder to digest. And these undigested proteins will then unfortunately get absorbed into the intestinal wall because the lining is leaky. And once these undigested proteins are in the intestinal wall, they're met with the immune cells, which then they mount an immune response because these proteins should be broken down into amino acids and then absorbed, but they're entering the true interior of our body intact or semi-intact, and that triggers an immune response. And your immune system will try to neutralize it, but it doesn't happen because rather than forming clear antibodies to the food, because that would be detrimental, this child will not be able to eat anything. So what ends up happening is that the body, our immune system will make antibodies, but they will not completely destroy the protein, but instead they will create antigen antibody complexes, which will then get absorbed into the bloodstream and start floating everywhere. It flows everywhere. It gets redistributed into the systemic circulation. And then what happens is that wherever these antigen antibody complexes end up settling in the end organ tissue, we see local inflammation developing. And over a period of time, this local inflammation can manifest itself as thyroid autoimmunity. It can manifest itself as rheumatoid arthritis, multiple sclerosis. It can manifest as lupus. And any autoimmune condition can be created in this fashion. So this is the connection between trauma and autoimmunity. Of course, autoimmunity, there are multiple other pathways to its formation. Trauma is one of the important pathways. And of course, trauma does not just cause autoimmunity. It can cause a whole host of other diseases, cancer, cardiovascular disease, strokes, all of this. In fact, early death. So the ACE study has clearly shown that early experience of adverse life events, the more number of adverse life events, the more risk for developing these chronic diseases later in life, leading to early death. So what does this mean? What this means is that we need to raise awareness and consciousness in our parents so that we can prevent the passage of this trauma onto the next generation. Any questions? Reach out to me. Take care and good mental health.